Hello, this is Sophia. It is week 3, day 28, following my underbite surgery. Hopefully you all can hear me okay. As you can see, I still have my braces and I still have my splint. You can see. Um, the splint is more of a cast and a way for my bottom teeth to align with my top teeth in the evenings. So I'm hoping in the next 2 to 3 weeks or so that the splint can be removed and then I can slowly start eating whole food. So I just wanted to give you a recap of the last 2 weeks, week 2 and week 3, and give you some tips on what's kind of helped me since it's getting warmer, get through the days between work and my course in the morning and kind of meal preps and what I've been doing for that. And then how my evening and self-care has been going over the last couple weeks. So my day usually starts in the mornings between 5:30 and 6, and I'm usually home between 5:30 and 6. So it's a really long day. Um, I started back to work day 23, and it was really exhausting. So I'm currently taking a course in the mornings until noon, and then I float over to work until the evenings. To get me through the mornings, I start my day off with cream of wheat here at the house. And then prior to leaving the house, I take with me my lunch pail with most of the food I'm going to be munching on throughout the day. And then I also prepare a shake. The shake is great because it's full of protein, peanut butter, all my fruits and veggies that will keep me going. And then by 9:30, 10 o'clock, I usually eat, I found these great go-go squeeze packets. You don't need a spoon. So these have been wonderful. I usually eat 2 to 3 of these a day. And then I follow it with pudding, any type of pudding or jello, and I usually do 2 to 4 of those a day. To keep everything cold because it is very hot outside. And although I'm inside, I don't always have access to a refrigerator. I've been using ice packs along with my lunch pail. I also carry around everywhere my spoon, whether I'm going to work or meeting somebody for dinner where there's soup or mashed potatoes. I always have my spoon. That way I always have something. One moment, I also found a great set of cases for my pills. Give me just a moment and I'll show you those. So instead of driving around town with my pill case, I found these little small ones, and I can divide up the types of medications I'm taking, and then it also lets me keep track of how much I have left. And they're just easy things to put in your purse or your backpack, and they're color coded, and you can tell. Let's see. As far as pain, week 2 was a lot better as far as pain. I'm sleeping now through the nights, at least 8 hours. I do wake up to use the restroom, and then when I'm up through the night, midnight, I also take my medication, which by morning alleviates some of the swelling I have. Typically in the morning, you'll notice following surgery that you're very congested, and it takes a while for the pressures in your face to come down. Um, so by taking your meds mid evening or before you wake up, it kind of alleviates that. So it does take me a little bit in the morning to get going, but once my meds kick in, at least by 9, I'm set. But by then, I'm already in through my morning and starting and all that. So pain-wise, I apologize, I'm skipping around. I'm talking a lot better. The splint I have in my mouth does make it a little difficult to talk um, and for folks to understand you. So what I did was when I'm talking to somebody, I let them know this is only temporary. It's going to get better. And I apologize, especially for not being able to hear me as clear. Um, Jaw pain. I'm still having issues and jaw pain on the left side here of my joints because a majority of my work was done on the left side. Um, I have a lot of pain still in my temple area, the left side of my head. My left eye socket gets puffy and tight. The tightness is the best way I can describe the pain I'm feeling. It's very tight, swollen. Um, I can smile now, but it still hurts. So I'll smile here. And when I'm not on medication, it's a lot more difficult and my mouth is more stiff. So that was probably the best smile I've had in a while. Um, the stitches all up here are starting to come out. You will experience a little bit of pain as the stitches are kind of making their way and dissolving. I had some pain underneath my nose, and I thought it was something wrong with my nose, like I had an issue or a pain or a pimple or something, but it was actually the stitches forcing themselves out, and now they're all clear. Um, but I still get majority of my pain here, the left temple, my nose, and my throat. I say my throat because my tonsils, when I don't have medication, my tonsils feel inflamed, and the roof of my mouth, funny analogy, but it feels like I'm eating a lot of cereal. And you know when you eat cereal and your mouth starts hurting on the top and kind of feels itchy and scratchy? Well, that's how my whole mouth feels, but it's painful. Um, you'll feel like the sockets of your teeth are a little painful. That's more so the gum line area and where the stitches and the incisions were made. So outside of that, that's pain, the pain that I've been having. As far as oral hygiene, the splint, of course, is making it very difficult to clean the upper part of my teeth. I do have a water pick, and I don't do this unless it's recommended by your surgeon. But I've been using a water pick to get through these little small areas, and at least it pushes through some of the food and bacteria, so it doesn't cause my breath to be smelly. I do use a normal brush for the bottom of my teeth because I noticed the baby toothbrush just was not cutting it now that I'm eating a little bit better and more consistently on the bottom of my teeth because there was a little bit of plaque growing and it was driving me crazy. So I've been using my Sonicare toothbrush, promoting Sonicare, I love it, on the bottom, and then the baby toothbrush on top to include my water pick just to get everything out. I don't recommend using the water pick on the inside of your mouth because it's going to make you bleed and be painful. So with that, that's some of the dietary nutrition items I've been using and uh, oral hygiene. Self-care at home, I've been sleeping through the night. I'm now back in my bed as of 2-3 days ago. I'm still waking up here and there, but at least I'm getting a consistent night's sleep, which is important so I can continue my day and not be so tired. At the end of my day, I do come home every night and I take a nap, and I'm still tired come 9 o'clock, 10 o'clock at night. So my body is still recovering at 28 days, and I expect to I've always been a nap person, but I expect to continue to take naps throughout my recovery process. Let's see. Um, I think that's everything that I wanted to touch on for this video. If anybody has any questions, please let me know. Work has been wonderful with accommodating me. Um, just know your days are going to be long, and to make sure you're prepared with your food. You don't want to be caught without having food because you're going to get hungry. You're moving more, so your metabolism is moving a lot faster. So I noticed that I was getting a whole lot more hungrier towards the end of my day, around 2 or 3, 4 o'clock. Um, I am lucky in the fact that where I work, there's tons of soft food, and the market basket upstairs actually serves soup. So that has been fulfilling for lunch. And then I also have been making pureed vegetables, carrots, squash, uh, cauliflower. Anything that you prefer would probably be the best. So with that, I just provide you this short video, and I'll leave you with a few profile shots, and then I'll see you hopefully in a couple weeks, if not during my next video. Okay, thanks. Here you go. Here's the front. Here's the side. And I'm really looking forward to, before I end, the swelling to go down and the ability to smile and the ability to smile without and talk without this splint. So far, I am extremely happy with the results. It's still been very challenging, a little embarrassing at times because you continuously meet people and they're like, "What's up with your mouth?" And you're explaining, and it's a it's a little different, but it's only temporary. And going into it, I knew it was only temporary. So um, definitely by week 2, things will get better. Week 3 is even better than the last two. And progressively, day by day, things will ease, pain will ease, and it should get continually better throughout recovery. So I look forward to the next, week 4, week 5, week 6, and hopefully start getting into eating regular food. Thank you.